If you can create positive experiences for young people in healthcare during their teenage years, we will teach them to approach rather than avoid.
Welcome to Talking About Kids. I'm your host, R. Bradley Snyder, researcher, activist, and author of The 5 Simple Truths of Raising Kids. This episode was recorded in front of a live audience on July 19th, 2023 at the Adolescent Health Conference in Phoenix, Arizona. And my guests are Veenod Chulani, Section Chief of Adolescent Medicine at Phoenix Children's Hospital, and Beheir Thompson, Adolescent Health Program Coordinator for Affirm. Along with their colleagues, Vinny and Beheir are working to bring professionals together to advance health equity for youth. Their insights on what adolescent-centered care entails, why it is important, and what steps you can take to become more effective when working with youth are next. This podcast was sponsored in part by the Arizona Department of Health Services Must Stop Bullying campaign through its Title V Maternal and Child Health Program. For more information, go to muststopbullying.org. And now, the interview.
For me, a lot of my public health interests and experience has been shaped by my own experiences, my personal experience. When I was a teenager and an adolescent, I struggled quite a bit with making sense of my world and the different struggles that I experienced and my friends were experiencing in society. And I didn't necessarily feel like adolescents were a valued or understood population. And so that's kind of where it started for me, and it just continued from there.
Yeah. I think, like Beheir, very, very similar. I mean, I'm an adolescent medicine specialist, and many folks don't know we exist, but we're a specialty of about 700 healthcare professionals in a country of 40 million teenagers. And we exist because teenagers exist, and we exist because of and to be in service of young people. And you know what really drew me into adolescent medicine and this path into adolescent-centered care is I grew up in a different place and time. I grew up in the Philippines. And being a former colony and my mind having been colonized, we always looked to America. Like American youth had like the spunk of MTV and the adventures of Ferris Bueller and the youth culture of Porky's. And then I moved to the US and I happened to get exposed to inner city youth. I worked in Bed-Stuy and I've worked with young people in the east side of Los Angeles and young people that were really disconnected from care. And I saw a very different side of America. And you know, inner city young people will come to you with very complex problems, unintended pregnancies and substance use and interpersonal violence. And I found that we made young people the posters for everything that was wrong with young people. 3 strikes when you're out, and we labeled them as super predators, and we made them poster children for everything that could go wrong during the teenage years. And we stopped seeing them as assets. We started seeing them as liabilities, as problems to be managed. And I thought, I want to be something different. And how do we advocate for young people? And that's really why I pursued sort of adolescent medicine, and it's been just a good ride since then. But I think my interest has also been shaped by my own experience as a queer, willful, difficult-to-parent child, to parents that were born and raised in a different place and time, and thinking about how might I raise a generation of physicians and pediatricians in the healthcare workforce that my parents, that I could have benefited from when I was growing up myself.
You know, I think that we've all experienced this issue of teens being vilified. But you know, the very nature of the topic that we're addressing suggests that there are barriers, that adolescents aren't getting the care that they need. What's the evidence that they're not getting the care that they need?
Well, I think the evidence that adolescents aren't getting the care they need not only come from our personal experiences. We all see gaps in care. If you're a frontliner, you will see gaps in care when you're working with teenagers. But when you take a look at survey data, for example, the National Survey for Children's Health, about 1 in 4 Arizona young people between 12 to 17 years of age are what you call youth with special healthcare needs. They either have or are at risk for having a chronic physical, developmental, behavioral, or emotional health condition. 1 in 4. The gold standard when you're caring for youth with special healthcare needs is a medical home. And a medical home is an approach to care that is coordinated, that is comprehensive, that is culturally effective, that is continuous. 2020 to 2021 data shows, however, that less than half of Arizona youth with special healthcare needs were actually connected with the medical home. Almost all parents said, my child is receiving care in a poorly functioning system. Adolescent well visits, which is a big area of focus of ADHS. We know how important adolescent well visits are to staying healthy. It's when we promote health. It's where prevention is the focus. It's where we screen for problems. In 2021, only about 60% of Arizona youth actually had a well visit. And this is not just an Arizona problem. This is a U.S. problem, although I will tell you that Arizona performs at the bottom of the pack when it comes to measures of states, not only for privately insured young people, but also for commercially insured young people. Mental health. We know we're in the middle of a mental health crisis. In the 2022 State of Mental Health in America report, about 1 in 6 Arizona youth 12 to 17 years of age reported having had a depressive episode in the last year. Only 70% actually were not receiving treatment. Only 30% received treatment in the last year. And even in the best performing states, you still had 30% of young people that were not accessing care.
Beheir, where are you seeing evidence that there are barriers to the adolescents getting the treatment they need?
Well, I think the issue is that most healthcare services are not designed with adolescents in mind.
Okay.
And so we see pediatric services, but what do we mean by pediatric, right? What do we have in mind when we perceive what pediatric means? And what we see most of the time is it's that 0 to 12 age range, right? Somehow when we get to 13, there's this age of innocence that's lost. And we no longer have the patience. We no longer have the compassion and understanding for these youth. And so there's been many programs to offer school-based health centers, shout out to all the school-based health centers in the room, to access services for those young people because sometimes they avoid or delay care because they're worried about parent involvement. They don't know what they should or shouldn't share with their parents. They don't know what providers' biases are and what their perceptions will be when they walk into a clinic. And so we're trying to increase their understanding of what their services should look like as their own public health advocates, but also increase the knowledge and understanding of healthcare providers so that they know.
So Beheir, you started to touch on some of the kind of hallmarks of what might be considered adolescent-centered care. But before we go there, can you address a little bit about why we want adolescent-centered care? We know that they're different, but what are the consequences of adolescents not getting the care that they need?
So we know that health across the lifespan is impacted by health across the lifespan. And so when you're not accessing the services that you need as a young person, that greatly impacts who you are, how you respond to things, how you interact with your society and your social interactions. And so we're trying to make it to where young folks get the services that they need so that when they are adults, when they do grow up and they come into society, they know who they are, they know how to use their voice and advocate for what they need.
Vinny, what are you concerned about when you think about adolescents not getting the kind of care that they need?
Yeah, separate from the here and now. When you're not accessing care, when you're not getting care, you know you're dealing with unmet health needs that impact your health now. But more importantly, again, like Beheir alluded to, I mean, you have to view this from a lifespan perspective and from a life stage model. Each stage builds upon the gains or the losses of the one that preceded it. Yeah. right? So adolescents come into adolescence reflecting the gains and losses in pediatrics. Adolescents will go into adult health reflecting the gains and losses during their adolescent years. And I think we really also have to view adolescence as a period when health behaviors are formed.
Yeah.
And health behaviors that are formed in adolescence will continue into their adult years, where they will impact rates of chronic disease, where they will impact life expectancy, where they will impact morbidity and mortality. And I truly feel that if you can create positive experiences for young people in healthcare during their teenage years, we will teach them to approach rather than avoid. You know how we have like our parents who you have to like harass, go to the doctor, right? I'd like to think that we can raise a generation that regards us positively and approaches us by creating positive healthcare experiences.
You know, I know that we're here speaking at an Adolescent Health Conference, but given that not all my listeners are here today, what are some of the things that make adolescents different? You know, you mentioned, Beheir, that we have pediatric care, and then they hit 12, 13, and we seem to want to push them aside. What makes adolescents different?
Well, their brain development to begin. When you understand the developing brain, you understand that it's not fully developed until the age of 25. And so what we see as this increase in hormones is so much more than that, right? And so we just really need to try to understand what the developing brain means for an adolescent, and also try to understand what type of care they feel they need and what type of care they feel they need in a social setting, not just healthcare.
Yeah, I just want to go back as well to what Beheir said about brain science, right? Because I think brain science has also backfired a little bit on adolescents. This understanding of executive function is not something that you achieve until perhaps your 20s, and your prefrontal cortex is the least developed part. Neither should we take it to mean that young people are incapable of making good decisions, that young people are incapable of self-regulation, because sometimes that's the angle that we approach brain science from. Again, it's a deficit-based approach rather than a strength-based approach towards adolescence. But I think one of the big differences really between adolescents and kids, between adolescents and adults, is just what adolescence is for, right? Adolescence is a universal experience. It's a time of life when we figure out who we are, our ego identity, our vocational identity, our moral identity, our sexual identity. It's when we separate ourselves from our parents and we figure out who we are through discovery, through experimentation, where we take the best of what we've learned from our parents and we take the best of what we've experienced, so that we come back and amalgam and we become a unique individual that's not just a clone of what came before us. And so you really have to view the approach as thinking about what's important to the adolescent. Body image, peers, autonomy, confidentiality, experimentation, efficacy, which is very different from the developmental tasks of pediatrics. When you go to a pediatric physician, when you go to an infant visit, they ask you, are they walking? Are they crawling? Are they talking? Do they have a pincer grasp? These are the developmental tasks of adolescence after you've achieved your motor milestones and your speech milestones. They're often unseen. And it takes creative approaches to really get to the adolescent. And the task during visits with the adolescents, is to figure out, has this adolescent accumulated assets? And are they prepared to succeed?
You know, we kind of live in a checklist society. And it was, very helpful when SAMHSA came up with its 4 R's of a trauma-informed approach. It's nice to have those kind of like benchmarks and hallmarks to call on. So for each of you, what do you consider to be the hallmarks of an adolescent-centered approach? What do you look for? What are the first things that you want to put in place?
It's those principles that I mentioned. So cultural humility, for one, right? Understanding that we aren't the experts of someone else's bodies. We're not the experts of someone else's experiences. offering them the opportunity to share what they would like their healthcare experience to look like, but also affordability, flexibility, all of the different things that we'd like for a universal healthcare type approach to certain things. But I look for compassion and understanding and patience, the humanizing of adolescence.
Vinny?
So I think back to some of the criteria that's been put forth by the American Academy of Pediatrics and the Society for Adolescent Health and Medicine. We want care that's accessible. We want care that's affordable. We want care that's culturally effective, that is coordinated, where there's access to confidentiality, and that's flexible. Because when you take a look at office hours, oftentimes they conflict with young people's school commitments, after school commitments, work commitments, so that's flexible. And that really sort of reflects adolescents' developmental and social characteristics is what we look for.
You know, that your discussion about the autonomy of the adolescent, seeking care,
Yeah.
is kind of conflicting with both with laws, and as we've heard from so many young people who presented today, there are logistical problems associated with their autonomy. Let's talk about some of the barriers that you're seeing that are stopping more systems from being adolescent-centric.
So there's barriers across all 5 levels. If you're looking at it from a social ecological model, there's barriers, many. Interpersonal, there's intrapersonal, there's community, there's policy. A lot of young people run into linguistic and cultural barriers. There's a limited knowledge of healthcare experience or healthcare services, and there's poor experiences. So if they've been to the doctor with their parents before, it's either from the perspective of their parents or it's from the perspective of the healthcare provider. So they're operating out of those poor experiences sometimes, if you want to.
Yeah, I think I agree with Beheir.
Yeah.
So what does it look like, and think about telling the story of what it looks like when an organization or agency gets it right in terms of adolescent-centric approaches. How do you know it? And tell that story of what happens to maybe from when the adolescent first encounters the service or becomes aware with it. What do you want to see happen?
So I like to think of it as before the encounter, during the encounter, after the encounter. Oftentimes we think of the encounter as just what happens when the visit starts.
Right.
It begins with a phone. It begins with when I call your office. If you ever call my office, you will find that the message is if your child is, what if I'm a young person who is an independent consumer? The audience is still oftentimes really the parent, right? And so I'm going to speak to our adolescent champion model, which is really a process through which we help health centers become more adolescent-centered. And we have health centers collect surveys from young people, so that way they're getting feedback. But we also do a walkthrough. And it's interesting when you do a walkthrough and when you get adolescents' feedback around the many ways that you can really, even little things like having your Wi-Fi password in your waiting room, so that way I can get on my phone, and signs and just little tweaks. And I think it really speaks to the importance of getting youth input and creating that participatory culture where we invite young people to provide feedback and inform our programs and our services.
I know that because of changing laws, even the issue about what can I ask of an adolescent, can I survey them for their feedback? These are questions that are in debate right now. So I guess kind of twofold. One is, where do you recommend people go so that they can get answers about what they are allowed to do legally and what they can't? And we'll start with that question about what kind of feedback you can get from an adolescent, because we're sitting in Arizona right now, there's laws about what and how you can survey minors. So where do you go for really hard information? Because I think what's happening is because of the rhetoric around what we are or not allowed to do, what we are allowed to provide, what we are or not allowed to ask, so many of us are pulling away from doing anything.
Yeah. So first of all, in terms of what you can and what you can't ask specifically about your services, you have to qualify what's research and what's not research. If what you're doing is considered research, minors cannot participate in research without the consent of their parents and caregivers. If you're looking to evaluate your program, aspects of your program, which falls under quality improvement is not research. And you can actually engage young people in providing feedback, as far as your programs and your services go. As far as what healthcare providers can and can't offer, and what adolescents can and can't access, and what you can and can't talk about, is actually something that we're going to go into additional detail tomorrow when we talk about adolescent consent and confidentiality. While the rhetoric is floating, the laws haven't necessarily changed.
Any advice on that?
So from an adolescent health programming perspective, we have our website, which is healthyazyouth.org, where we have a resource hub of many different resources. You type in your keyword, if that's minor consent and confidentiality, minor rights, we have that information. We also have handouts and posters available that detail the ins and outs of what to expect as a minor, the things that you can and cannot share with a provider, the things that the provider would have to report as a mandatory reporter, and also the things that you should or should not share with your parents. It also details having alone time. A lot of adolescents, less than half, experience or have that alone time with providers. And so it's very important for them to know that that's something that's available to them. All of that is within our resource hub. It's also on our teen health rights posters and handouts.
At the risk of asking an obvious question, why is that alone time important with a provider?
So again, when we're talking about becoming your own advocate and having your own healthcare experience, you as an adolescent have to understand that you are the leader, right? You're the expert in your body. You know what it is that you would like to see when you go into a healthcare office. And so we're trying to create that autonomy and allow them to know that it's your right.
For me, that alone time also really supports adolescents developing autonomy. And nothing magical happens at the age of 18. Right? Young people progressively assume the cognitive capacity, the ability and the development to become independent consumers of their healthcare. And sometimes you will find that parents might recoil, like, why do you want to spend time alone with my child? And you have to view this from the parent's perspective as well. Parents are not the enemy, and just as teens have to adjust to being teens, parents have to adjust to being parents of teens. But if you phrase this to parents positively, one day Johnny's going to have to go to their own doctor visits and manage their own health care, just like just like your parent doesn't take you to your visits. These are preparatory years, and I think when you phrase it positively and as a way for young people to build skills and competencies, parents are really open to it.
And I hope you understand when I make this next point that I consider myself an advocate. I've been working with adolescents for a really long time, and I believe in giving them agency. I also know that not everything that we do in our adolescence is good. We make bad decisions in our adolescence. I have a yearbook full of haircuts that everyone in that picture says I made a bad decision with that haircut in my adolescence. So it's a balancing act, at least I see it is, between allowing them to kind of pilot their own way and guiding them. Can you talk about striking that balance?
You want to hit that one?
Go ahead.
I think as adults, as folks who have been through the adolescent stage and the adolescent experience, there's no greater gift than to help them become who they are, right? Or experience or discover who that is. And so I believe that allowing adolescents to enjoy and experience their humanizing and who they are as individuals is what we're here to do. I believe that adolescents shape their futures, and we're here to allow that autonomy, but also to give them the information that we have as experts in the adolescent stage, to allow them to grow and develop in the ways that they see fit.
And so let's stick on that for just a second, though, because if you're talking with a young person and you're going over some decisions that they're considering, and you know from your experience that one of their options is the wrong option, how do you preserve their autonomy and steer them away from that really bad decision?
The idea is that we're all going to make wrong decisions. We're all going to make mistakes. My husband in particular always says, it's important for you to have that productive struggle, right? It's important for us to watch you live through and make some of your mistakes, right? But hoping that those things are not something that you can't bounce back from. Right. And if it is something that you feel you can't bounce back from, how can our resilience build your resilience? How can what we've been through in our experiences help you to feel the compassion and empathy that you can move past that?
Vinny, how do you help them avoid those decisions that look, I respect you, I respect that you're taking control and you want your autonomy, but you have to know that that one of those options is the wrong one. Yeah. How do you help with that?
I think it's really about how you deliver it. We've all been teens, right? The harder you push, sometimes the harder they push back. Right. And it's really about being skillful and being creative, how you use tools like motivational interviewing. And when you talk about so there's permissive parenting where everything and anything goes, which is not the way. There is authoritarian parenting where you're hard and firm and too rigid, and young people will find a way to escape the clutch. And then there's authoritative parenting where there are clear expectations, there's love, there's space. And I really liken the adolescent years to the toddler years. There is no other time of life of such dramatic physical and psychological and social change. What do we allow toddlers? We create guardrails around them, but we allow them room to roam. Adolescents are super learners. They are super learners. We need to give them the space to learn. But we need to have guardrails around them so that we know when they're skirting the edges, and then we can bring them back. And that's where screening for substance use, so that's where screening for STIs, that's why we have screenings in place. And I think the best thing that we can do as healthcare providers is to build relationships where we can obtain honest and skilled responses so we know when adolescents are skirting the edge, when you know to pull them back using motivational interviewing. I've had adolescents who were just going down a path, or where my only hope is I hope that the light bulb comes on before you do irreparable damage.
Right. What are some of the mistakes that you see organizations or even individuals make when they are targeting their expertise, their services, their programs to adolescents?
The communication casualties. Yeah. So if you're in interview or if you're in conversation with a young person, you're asking questions like, well, you're not sexually active, are you? Right? There's the tone and the different ways that we ask questions and the different ways that we open communication with them could be a mistake. Bigotry in disguise. So, I'm up here, you're down here. Some of your decisions and the things that you do as you move about your life, I may not agree with, and I'm showing that in nonverbal and verbal ways. Also, power inequities. Right, we all know when we walk into a doctor's office with the white coat, we're already intimidated, and here you are coming in with a different stance or attitude that may not align with who I am as a young person.
Yeah, exactly what I was going to say. When we don't share power, because there's a power differential in that dynamic, not only because of who we are professionally, but there's an age divide. It's when we don't share power. And the task really when you work with adolescents is to enter into power sharing agreements to build collaborative, trusting, therapeutic relationships. And it's also when we hog expertise and we don't think of adolescents as being capable of experts in their own lives, in their symptoms, in their strengths.
You know, at the same time, though, Vinny, we're not their peers. And, you know, I think that I've seen, one of the things that we can say about adolescents is that their mendacity detector is incredibly high.
Right.
They know if you're not genuine. So if you go in and say, no, I'm just your peer, is that going to ring true to them? Do they want another peer?
And I don't want to be their peer.
Okay.
You don't want to be the parent. You don't want to be the peer. You want to be the extra parental adult. Sometimes you need an extra parental adult, the cool uncle, the cool aunt, right?
Right.
You want to be the approachable extra parental adult.
So you're not giving up your adulthood
Right.
in these interactions. Is that right, Beheir?
Right.
Okay.
We have seen studies, though, that show that young people would prefer to have some peer-led programming, right, or have a peer advocate who could be in the room with them as they're experiencing that healthcare interaction.
So how do you do that in your programs? How do you show the example of the peer, and how do you engage so that peers are part of the intervention?
Yeah, so again, it looks like school-based health centers, community partnerships that offer youth advisory councils or teen advisory councils to bring that youth voice in, and also create programming that allows for young people to have that voice and that partnership with other youth.
Vinny, what are you doing at Phoenix Children's Hospital to help adolescents see themselves in your programs?
We have a very engaged, really patient population. We have a parent advisory council where parents provide feedback on our services and, you know, provide input on the ways that we might improve care. We also have a children's advisory board where we have patients of the system that walk through different areas and really provide us with feedback. So we really do our best to try and leverage youth voice and patient voice and choice.
And all care should be delivered in hip-hop form. Is that correct? Yeah, I mentioned it. I know that this was, I've done actually a lot of work with networks, children's television networks, and there was a rash for a while that said if we wanted to make it adolescent-centric, we just wrap it, and that'll be okay. And that was something that, like, universally all adolescents thought were horrible. That was just a horrible idea. So when I talk about other mistakes people make, along that line of saying, well, no, it has to be in rap form, or it has to have this celebrity endorsement, what are some common things that people like grab onto when they think, oh, I'm going to try to engage a teen, therefore I should do this?
Well, I think it speaks to what you were talking about, right? They pick up on your genuineness,
Right?
right? And so if you're dressing like a teen, or you're using their slang, or you're, you know, trying to be in the in crowd, they pick up on those signs that, you know, you may be trying to connect, but you're trying to connect in the wrong ways.
Do you see any of those common mistakes, Vinny?
Yeah. I think when you try to be too cool, when you know, just sort of pander to adolescents, perhaps.
Right.
And honestly, Brad, I've reflected on this and sort of my own aging process as a provider that's really dedicated myself to, you know, kind of caring for young people. And I think of well, you know, you're kind of gray now. Like, how do young people see me, especially with their perceptions of age and right? Like, was it our young person who said, I'm an old man? I'm like, you don't know old man. when I think of how young people see me, but then I always go back to, you just need to be real. You for as long as you come in and you're compassionate and you're authentic and you meet young people where they are and you come in with the best of intentions and you remember that, I think you'll be good at this.
You know, I think it's really easy when we get professionals together because we're trying to develop new skills, that we do look at what's lacking, where the deficits are. What positive things do you see happening in terms of the world of adolescent-centric care What are the developments that have occurred, the successes that you've had or that you've seen?
I think a big success, when I think of adolescence, I think of a responsibility to adolescents everywhere, not just in the developed world, but in the global south and in underdeveloped countries where there's still a lot of loss of capital. Like there is now a growing worldwide recognition of adolescence as this critical developmental stage of assets. And thinking about adolescence in the global south and the developing world, and you're seeing the United Nations and the World Health Organization really advancing platforms that advance adolescent health. Taking a look at where are the losses, how we lose adolescence and adolescent potential to childhood marriage, how we lose adolescence potential to women not having access to education. And this is a movement that is happening globally, which is really exciting for me because I think that's a part of the world that's lagged.
What successes are you seeing, Beheir?
More funding for adolescent health programming is where we're seeing it. And so, if adolescents don't understand where the services are, if they don't know where that help is, we're going to continue to see a lack or avoidance of accessing care. And so we're trying to make sure that folks know where to find services. We're increasing our clinic locators. We're increasing our partnerships across the community. And when I say we, I mean across the United States, to make sure that adolescents understand that they're a welcomed and valued population.
We know from the people attending this conference here that they are all reaching adolescents in different stages, in different places, different times. I know that you are both involved in kind of coordinating and supporting people across all of these different silos. Can we talk about that a little bit, your work to get more support to all people working with adolescents?
Yeah, so we, as adolescent health advocates, we're proud to have the Arizona Alliance for Adolescent Health, which has a focus on delivering, increasing care delivery for adolescents and also improving access for adolescents in Arizona. And so with that, we're trying to improve and increase coordinated care. We have medical, behavioral, and social health providers who meet on a consistent basis to talk about the different barriers that exist for adolescents and how we can reduce those barriers.
Yeah, Vinny, tell me a little bit more about this group.
Yeah, so the Arizona Alliance for Adolescent Health, and you're going to hear much more about the Alliance during this meeting, by the way. We really a grassroots group of individuals and organizations that work with young people and that are committed to making sure that young people, are their healthiest and their best, and that we also address inequities in the system. So we have several areas of focus. We want to improve access to quality and coordinated care and inclusive care and developmentally appropriate care for young people. One area of activity we have is we work with health centers. We are now in our 5th cohort of health centers, and we have 7 health centers that we're currently working with, where over 18 months, we work with them around how they can tweak their services to become more adolescent-centered. The other area that we're actively involved in is in developing and disseminating training and resources to improve adolescent-centered care that we want to get to our frontliners. We've developed resources on confidentiality. We've developed resources on the Teen Health Guide so that adolescents can be better informed. What do I need to know about the well visit, and how can I better advocate for it? But really, our third area of activity, which we're very excited about, is how we cultivate a community of individuals that will look at how can we collaboratively work to advance adolescent health in Arizona. And that's really what we're here for today. We want to be able to continue the camaraderie and the community that we have here, and carry that post-meeting.
I sometimes think that adolescent-centered care is a lot like being an adolescent. Sometimes you feel so alone, right? That's the constant comment that comes from adolescent. They feel like they're the only one who's gone through this, and they're isolated. And I feel like this being involved in this kind of care feels that way. What kind of words or encouragement can you offer to the professionals here, but also the ones listening, to support them as they begin to create or further their adolescent-centered work?
So I'd say that as humans, we all seek welcome. We all seek to have a sense of belonging, right? We all want compassion. We all want patience and understanding. And with that, we have to find folks that align with our values. We have to find organizations that align with our values. We have to create those if they don't exist. And I would say stay encouraged in the fact that we are making progress. You being in this room, you listening to this podcast means that we have folks who understand the importance of this movement, and you're creating a positive and welcoming experience for adolescents.
I always think, too, again, that, like, the power of one. We started with that this morning, and just reminding healthcare providers and social service professionals and folks that touch adolescents in the different ways that they do, that their work is meaningful and that they are making a difference, but also just alluding to the importance of self-care. Like, especially as we do this work in difficult conditions, and we're all coming out of the pandemic, and just also know when to how to recharge, because there will always be youth to serve, and it doesn't serve youth well if we run ourselves haggard, and if we bring ourselves to a point where we can't continue the work that we do because young people are counting on us.
This community is really lucky to have two people like Beheir and Vinny here, so please give them a round of applause.
That was Veenod Chulani and Beheir Thompson. For more information about them and the Arizona Alliance for Adolescent Health, please visit our website, talkingaboutkids.com. From there, you also can find out about upcoming episodes, suggest a topic, learn more about me and my books, or submit your questions for future guests. Our theme song is by The Senators. For more of their music, go to thesenatorsmusic.com. I hope you enjoyed the episode. Talking About Kids is a weekly podcast, so please subscribe. And remember, kids are young goats and young humans. And the difference is that young goats are easier to manage.